Thank you for joining us for the AAKP 47th Annual National Patient Meeting. My name is Toni Martin, and I am an AAKP Ambassador for the state of Ohio. As a kidney patient myself, I have been on and off dialysis since May of 2001 and received a second kidney transplant from a deceased donor in April 2018. My first kidney transplant failed due to cytomegalovirus virus known as CMV and had to be surgically removed due to fracture. At that time, I returned to in-center hemodialysis for approximately 3 years before transitioning to home hemodialysis for 4 years until finally receiving the priceless gift of my second kidney transplant. My involvement with AAKP began back in 2005 when, along with my daughter, who was only 7 years old at the time, attended our first AAKP National Patient Meeting. Meeting the AAKP leadership, professional staff, and fellow patients who are going through the very similar experiences as I was inspired me to make sure that kidney disease would never define me, that I was always in control even during the hardest days. That meeting also inspired my daughter, who at such a young age learned everything she could about kidney disease and grew into the most wonderful care partner I could have ever asked for. And as an individual diagnosed with kidney disease at a young age with a daughter to care for, it's imperative that we fight for early disease detection and the appropriate diagnosis of rare genetic conditions that may lead to kidney disease. It is also critical that as patients, we raise our voice and become the leader of our own healthcare team to demand access to the latest innovations and treatment options and devices that are available, and help advance research to change status quo kidney care. Today, I'm so pleased to moderate today's session on staying upright, preventing falls and injuries in CKD. As individuals managing a chronic illness, there is naturally a number of related health conditions many of us face. Diabetes, high blood pressure, and anemia, just to name a few. But many individuals do not realize that hemodialysis only can put patients at higher risk for a fall, particularly at the end of treatment. Coupled with advanced age, those individuals with CKD at an even higher risk. Today we have a friend of mine and AAKP's, Dr. Stephen Fadem. Dr. Fadem is a clinical professor of medicine in the section of nephrology at Baylor College. He is also chair of AAKP Medical Advisory Board. As a champion for chronic kidney disease education, Dr. Fadem was one of the first doctors to discover the value of the internet for patient education and founded several websites dedicated to public service and the dissemination of clinical information, including the Nephron Information Center, WikiKidney, TouchCalc, and DialysisUnits.com. Dr. Fadem is the recipient of the National Kidney Foundation's Distinguished Service Award, the AAKP Dr. Peter London Award, and the AAKP Medal of Excellence. He is also listed in America's Top Doctors and serves as a historian for AAKP. Dr. Fadem joins us today to share how CKD patients can protect themselves from falls and injuries. Dr. Fadem, we are honored to have you present today. I turn it over to you.
Hello, everybody. I'd like to talk about falls. Falls are very, very serious, and there's a lot that we need to know about it. We may be able to prevent falls, or we may be able to mitigate the fall so that it's not so damaging. I'm Steve Fadem. I'm a clinical professor at Baylor College of Medicine, and I'm chairman of the Medical Advisory Board for the American Association of Kidney Patients. In this talk, we're going to give you a helicopter view of falls. We're going to talk about the introduction, the types of falls, and we're going to talk about two basic categories: non-mechanical falls and mechanical falls. 1/3 of the general population fall each year, It's the second leading cause of unintentional deaths worldwide. 684,000 people die from a fall each year. 37.3 falls out of 100 will require medical attention. 44% of hemodialysis patients fall each year. Falls occur for many reasons, but we can decrease the incidence and the severity of falls. So let's find out how. There are two basic giant circles of falls, and yes, they do intersect. One circle is mechanical falls. So wearing the proper footwear, staying off slippery floors, and being careful on ice patches, using grab bars, don't trip over clutter, making sure that the carpet isn't loose, and using your walker and your cane, staying off uneven surfaces, or don't trip on those surprise steps or ledges, always using handrails, use that night light, and avoiding glare. All of those things can help us prevent a fall. Just thinking about it can help prevent a fall. If you think about falling, then you might be careful where you step. The next thing is the non-mechanical falls. This happens when we have a medical condition. The major indication of a non-mechanical fall is a previous fall. Usually people don't just fall once, they fall several times. Age has a lot to do with it. As we age, our body loses muscle. Sometimes we can prevent that. And we lose balance because we lose muscle memory. Our vision can go bad. We can develop gait disorders. And that can happen with many things, especially kidney disease. If we have hyponatremia, that can cause gait disorders. Loss of balance is associated with gait disorders. Loss of muscle or sarcopenia, the medications we take, getting dehydrated, having diseases that we may not have any control over, such as dementia, Parkinson's, or strokes, can be related to falls. Heart disease can cause falls. Diabetes, other chronic illnesses, chronic kidney disease, nutrition and vitamin disorders can all cause falls. There's a lot of stuff to falls. In fact, so much that I'm writing an entire book just about falls. It's going to be available next year. But here's a bird's eye view for you. So let's just talk about the mechanical and non-mechanical falls. Okay, we mentioned the cognitive decline, chronic illness, and medications. Those are the three major categories of non-mechanical falls. The most common things that we need to know about mechanical falls are 82% of them are going to occur in your own house. 69% not just in your house, but in your yard. 69% indoors, but 57% while you're walking, 31% while you're standing. 16% of falls can occur while we're in the bathroom, taking a shower and falling on a slippery floor, for example. In hemodialysis, 73% of patients who fall will fall after the dialysis treatment. Dialysis can be associated with a low serum albumin, sarcopenia, and a low vitamin D level. What about non-mechanical falls? Well, the first thing to think about with non-mechanical falls is that it's associated with frailty, stroke, and dementia. Frailty is common in chronic kidney disease. It's characterized by inactivity, weakness, exhaustion, a slow gait, and weight loss. It can occur for many reasons, and sometimes it's not reversible, but it can happen with poor nutrition, uremic toxins, severe muscle breakdown, inflammation, and heart failure. The biggest problem that patients who are frail have is that they can fall and either hit their head or break a hip. Frailty is associated with a very high incidence of mortality. What about strokes? Strokes are associated with chronic kidney disease, and they can be related to the traditional risk factors of high blood pressure, salt intake, atrial fibrillation, lipid disorders, or diabetes. And that too can be associated with chronic kidney disease progression. Chronic kidney disease progression itself is associated with stroke. It can be related to non-traditional risk factors such as genetics, uremia, oxidation, hyperuricemia, damage to the lining of the blood vessel called endothelial dysfunction, and mineral and bone disorders. And dialysis itself can be causing a stroke. For example, during dialysis, patients can have a decreased blood flow. They can drop their blood vessels. Dialysis can cause the blood vessels to become stiff. It can cause hypertrophy of the heart, left ventricular hypertrophy, that can make the heart function less well. It can also cause cardiac fibrosis, which can cause arrhythmias. It can cause chronic inflammation. And of course, vascular calcification accompanies longstanding diabetes. Falls are related to strokes. Stroke patients have the highest risk of falling. 37% of patients who have a stroke are going to fall within 6 months and 73% in 1 year. So what do we do when we have a loved one with a stroke? First of all, we try to get them in rehabilitation to help them as best we can with their balance and their gait. We try to help them with muscle weakness. We try to help them with their vision, with cognitive function. And we try to make sure that the home is modified for their safety. But the most important thing we can do is to get them into an assistive device, a walker with a seat on it or a wheelchair. Critical for patients who've had a stroke. What about dementia? Again, when one becomes demented, it's a sad situation. It can occur as we age. It's something we all have to ultimately look forward to. It's an ultimate part of aging, believe it or not, but we can delay it just like we can delay aging by controlling our blood sugars, controlling inflammation, and controlling our blood pressures. Those of you who listened to my last talk will know a little bit more about what we can do with respect to aging. But the problem is that the filtration rate might not necessarily represent chronic kidney disease because there are other things like biomarkers that can be associated with it. But as we age, we lose about half our nephrons. So aging and aging in the kidney, aging in the brain are very similar in that once you lose brain cells and once you lose nephron cells, they can never be replaced. So aging is related, and dementia they're both related to mobility and balance. Judgment problems can put patients in danger of getting into trouble more quickly. Patients can become confused as to how they take their medications, and they might take too many blood pressure pills. Sometimes it's hard to communicate. They might wander. A poor memory makes it more challenging to get around. Aged patients usually are depressed. They usually have urinary incontinence, and they have decreased depth and vision perception. They may forget to turn the stove off. They may forget to wipe up the floor so they can slip or have a catastrophe. In other words, when a patient has dementia, they need supervision. They need an assistive device and they need supervision. What about medications? The big problem with medications are that they can drop our blood pressure, drop our blood sugar, and they can over-sedate us. So we need to be careful to talk to our doctors and our caregivers to make sure as we age that we're not taking too many medications. Medications can be associated with falls. If your hemoglobin A1C is too low, if your INR is too high, this can cause falls. It can cause comorbidities. It can cause you to have a bleed. It's very important that we're very, very careful with the medications that we take, blood clotting medications and medicines to lower our blood sugar, blood pressure medications can all cause falls. They can cause serious problems. High blood pressure medicines can be a problem. We want to be careful because we want to keep our blood pressure well controlled, but we don't want our blood pressures too low. So it's a good idea to check your blood pressure at home. Use a cuff and check your blood pressure frequently, especially if you're on a lot of blood pressure medications. Sedatives. Sedatives can cause a lot of falls. In fact, patients who are on sedatives have twice the amount of falls as people that aren't on sedatives. They have 15 times the mortality. It's very important that we stay away from sedatives. Opiates are bad enough, but just blood pressure pills and anti-anxiety medications can be very serious when we get older. So we have to be very careful. So why do people fall? Most people who fall have fallen before. It's because of age, visual disorders, gait disorders, loss of balance, muscle weakness or sarcopenia, dehydration, poor nutrition, diabetes, heart disease, kidney disease, or many other chronic diseases. Non-mechanical falls. So we've talked about the non-mechanical falls such as age, debilitation, living alone, vision impairment, improper footwear, cardiac arrhythmias and heart failure, dehydration, postural hypotension, loss of muscle mass, uremia, and inflammation. All of these can cause us to fall, even if we're not, say, going to trip or be exposed to clutter. But what can we do? One thing is we can exercise. The more we exercise, the more our muscles stay stronger. Lack of exercise causes our muscles to weaken. Our muscles break down at 1% every year. So we want to exercise, even with resistance bands and walking. Metabolic acidosis can cause muscle damage. And with kidney disease, that's common. So we want to eat the right foods, mainly fruits and vegetables. And we want to exercise. Every day we want to do some exercises. Loss of muscle mass and a loss of memory can lead to poor balance. But muscles, by exercising, we can build up our memory and we can build up our muscles. Inner ear balance declines with age, but we can control that somewhat by doing balance exercises. Also, with inner ear problems, we need to make sure that we don't have some problems such as normal pressure hydrocephalus or an acoustic neuroma. So whenever you have a medical problem, always see your doctor so that you're making sure you don't have an occult medical condition that's causing you to have a loss of balance or have a problem. What about hemodialysis? At the end of dialysis treatments, the blood pressure is low, fluid status is low, your blood pressure might fall because you have diabetes and you can't regulate your blood pressure. Your blood pressure is related to salt. So if we remove fluids with dialysis, your blood pressure may drop very easily. Blood pressure medications can cause you to fall. Metabolic alkalosis can happen at the end of dialysis, and the potassium can be low. There's also the potential for a seizure at the end of dialysis. Dialysis teams are very aware of these problems and try their best to prevent patients from falling. Oftentimes, patients who are at fall risk need to be assisted to the scale and may need to be sitting down before they're allowed to go to their vehicles to go home if they look like they're going to be at risk to fall. One of the worst things that can happen when you fall, especially in dialysis, is that you hit your head and you can have a bleed inside your head. This is called a subdural hematoma or a subdural bleed. This has happened frequently. You hear about somebody who falls in the shower or when skiing, and they're fine. They go home and they die that night. And this can happen because the bleed is very slow. So if you fall and you hit your head, you should always go to the emergency room and get checked out, get a CAT scan of your head. It's a very simple procedure, and it can tell you whether you've got a bleed. Bleeds can be fixed, but if they're not fixed, they can be fatal. Preventing dialysis falls is very important. We need to assess the patients. We do a fall risk survey on the patients. We need to assist the patients to the scale. Don't let them drive a car or leave if there's any question of their stability. Encourage the use of assisted devices, especially when patients are at high risk. Treat patients with vigilance. Make sure that their medications are okay with their medicines, that their blood pressure and blood sugars are steady, and assure they're taking vitamin D analogs, and encourage the dialysis patient to be active. Activity actually helps patients when they're on dialysis. This is the fall survey that we've developed that we're using in our dialysis units. Hopefully it will catch on and be more useful to other dialysis centers. So how can we prevent falls? I'd like to spend the next few minutes talking about mechanical falls and how we can prevent them. Well, first thing, why do I show a picture of a bull? Well, the reason I do is that this 2,000-pound bull has a bull rider on it. This guy actually won the rodeo that I watched him at. He stayed on the bull more than 8 seconds. But if you're a rodeo rider, you're guaranteed to fall off. Rodeo riders have about a 3% chance of injury. Patients with kidney disease have about a 7% chance of injury. And they have about a 30 to 40% chance of falling. The guy here protected himself and really knew how to fall off that bull. However, most of the patients that we take care of don't know how to fall and don't even realize they too are destined to fall. So that's why we're going to talk about this. So how can we prevent non-mechanical falls? How can we prevent mechanical falls too? First of all, we talked about non-mechanical falls, such as frailty, stroke, and medications, and cardiac disease and diabetes. How can we prevent mechanical falls? First of all, fall-proof the home. Grab bars, slip-resistant carpet. The last thing you want when you step on your carpet is to have a magic carpet ride and then fall off the carpet and hit your head or your hip. Be careful of clutter. A furry little pet, cute little pet, you can trip over the pet. So be careful when you stand up. Make sure that Fido's not under your feet or the little cat isn't under your feet. Be very careful with pillows and ottomans. If you move something, move it back. The last thing you want to do is trip over your shoes or your trousers or something in your house. Make sure you don't trip on a towel. Make sure that you put a towel down on a wet floor and make sure that you try to dry your feet off carefully. Have a night light at home and use the grab bars. Use your guardrails. Don't ever walk downstairs or upstairs without hanging onto that guardrail. Let the kids do it, but you're not a kid. Don't take any chances. After a rough day of bull riding, the cowboy takes off his boots, his wranglers, his shirt, his hat. He throws them on the floor and he crawls into bed. He awakens in the dark and he trips over his duds and falls. Chances are he'll be okay, but you may not be. It's a lot easier to be proactive and leave the clutter off the floor. Get in shape. Resistance exercises, balance exercises, and learning to fall. I took this seriously when my trainer told me that one of her relatives fell, and she started training me to prevent falling. And I went into a very careful program to prevent falling. It may not be perfect, but it seems to help. So what do you do to stay in shape? use that resistance bands. The resistance bands are very inexpensive, and you can use those to do pull-ups. You can use them to do pull-downs. You keep your arms and your legs in good shape by using resistance bands. You either lose it or use it. If you don't use your muscles, they're going to deteriorate. Astronauts who go into space, they lose muscle mass very rapidly because of a lack of gravity. Bedridden is the same thing that causes you to have a lack of gravity. So the last thing you want to do is get into a situation where you're not walking, you're not exercising. It's very important because your body will break down muscles very quickly if you're not using them. Controlled trials have shown that exercises will help you to stay stronger. Balancing is very, very important. Now, I don't recommend that you balance using weights with your eyes closed. It took me a long time to get to this point, but just standing on one foot is a good start. Always have somebody with you when you start balance exercises. Don't try to do it alone. And sometimes get into the corner so that if you do fall, you just fall on a corner. You don't fall anywhere else. There have been 13 randomized controlled trials in CKD patients, and they do show that physical function can be improved and that you can actually help the quality of life when you exercise. Now, it's not going to guarantee that you're going to live forever, but at least you'll feel a lot better and you might reduce the falls that could put you in a hospital. The next thing is walking and alkali. We talked about how your muscles will break down. The other thing that can break down muscles is metabolic acidosis. So you don't want your muscles to be tagged and broken down. And the best way to do that is to eat properly so that your muscles will have enough proteins that they will be built up and won't be broken down. Balance. Balance is very important. It's very important to be able to balance just so that you don't fall down. A lot of us are balancing on Bosu balls, but that is a quite advanced exercise. The first thing is to try to just stand on one leg without any weights and see how you do with that. And if you can do well with that, try light weights and then try squats on a Bosu ball and then try squats on a Bosu ball with weights. The sky's the limit, but start slow. There's no rush. The other thing you want to do is to protect yourself. So if you're going to fall, know how to put your feet out to catch yourself. This exercise is very important. It's in the AAKP Renal Life article that my trainer and I just authored. So when you're about to fall, know how to put a foot out so that you block your fall. And that'll take your momentum. Sometimes you have to carry forward that momentum. The last thing you want to do is fall and hit your head or hit your hips or break your arms or your hands. So learn how to roll when you fall and learn how to make sure that you regain your balance quickly if you get off balance. So this is the book that we just wrote called Staying Healthy with Kidney Disease. I'm very proud of it, so I don't mind plugging it. It's a very good book that will give you a lot of information to help you to stay healthy. And that's the only reason that it's been published. And it's published by Springer. They also publish Scientific American. And they're also publishing our next two books, Complications in Dialysis, and our book on understanding and preventing falls. I would like to thank you very much for listening to this lecture on falls, and I'll be very happy to answer any questions that you may have.
Thank you, Dr. Fadem. As always, an excellent and informative presentation. On behalf of the AAKP, I appreciate you sharing your time and educating us on this important topic.